First of all, we're excited to be here. Today was a kind of a milestone occasion with a name change and so forth, but it builds on the earlier transition to Epic, the electronic medical records.
The merger that happened in May was actually the more straightforward part. It's filing a lot of paperwork, but actually to fully benefit from the merger, there's a lot of work that has to be done on the back end.
You know, you go through a merger, you're leading into that merger, there's a lot of due diligence done on each organization, but you really start to get to know one another after you've merged. The name change signifies that, you know, we're one, TidalHealth Atlantic. It's coming together, we're better together.
It's important to know it's the same great team taking care of family, friends, and neighbors, but I think what folks will quickly learn to appreciate is the fact now that the whole system is on one electronic healthcare record. Having one record allows a community member to interact with different points of the healthcare system without the paper being moved around or different charts or different electronic healthcare records having to talk with each other. So they'll have a much more seamless experience using the MyChart app.
We think about the delivery of healthcare. It is a team sport, and so our patients access services here in our hospital, they access services in the community through their physician, outpatient locations, across many of the existing TidalHealth facilities and locations. So this allows us to really streamline and create more of a connected system where the community, everybody's looking at the same record, regardless of where you are.
We're going to be rolling out patient education. Patient education is really important after our hospital experience. As I'm being discharged from the hospital, I might not always remember everything. That's kind of normal. Well, guess what? That information's in MyChart, so you can always have access to it.
We have some very ambitious plans to expand, again, not only on services that we currently offer, but to introduce new services that are enabled through Epic and our merger with TidalHealth, frankly.
One of the things we're getting ready to do down at Crisfield with the new site there is we're going to have robust primary care and urgent care, but there's going to be a telemedicine room. Well, through Epic, you can go into that Crisfield site and have a virtual visit with an endocrinologist up in Salisbury or a cardiologist.
What excites me is the commitment that Steve and their board and the interactions we've had with colleagues across the system to bring a higher level of care into our community. And that, to me, is why we did this.
We want to keep people healthy and well and out of the hospital. Well, the only way to really do that is to have a good relationship with the primary care provider. So find a location close to home. We've got lots of locations out there at this point in time. We're all on Epic now. Make an appointment, get a physical, get checked out.